আসসালামু আলাইকুম।
ওয়ালাইকুম আসসালাম স্যার।
শুনতে পাচ্ছ না? আচ্ছা
Yes, sir.
আচ্ছা ঠিক আছে।
স্যার একটা কোশ্চেন ছিল
হ্যাঁ বলো।
স্যার আমাদের প্যানক্রিয়াসটা শেষ নাকি স্যার ওটা পরে?
প্যানক্রিয়াসের আর তেমন কি মানে ওই যে বাকিগুলা মানে সব তো কভার করা যায় না একটা লেকচারে, কোনটা বাদ আছে মনে করছো তুমি?
স্যার মানে ওটা যদি আরেকটু স্যার আপনি যদি বলেন যে কোন কোন অংশগুলো বেশি ইম্পর্টেন্ট।
কোন কোন জিনিসগুলো?
জি স্যার, নাকি স্যার ওটা আমরা নিজেরাই দেখে
আচ্ছা ঠিক আছে, তারপরে আমরা সময় পেলে আবার বলবো না, অবশ্যই জানাবে যে কোন জায়গাটা। যেমন ধরো আমি তোমাদেরকে গ্রস আইডিয়া দিয়েছি যে মেইনলি প্যানক্রিয়াসের যেটা সেটা হচ্ছে রিলেশনটা খুবই বেশি করে জানতে হয়। আর প্যানক্রিয়াসের যে পিছন দিয়ে যে বড় বড় ভেসেল গুলো সেগুলা, তারপরে প্যানক্রিয়াসের গ্ল্যান্ডের লোকেশনটা, ডাক্ট সিস্টেমটা আর এক্সোক্রাইন পোর্শনটা, এইগুলো একটু ভালো করে জানলে মোটামুটি হয়ে যায়। কিন্তু রিলেশনটা ইজ ভেরি ইম্পর্টেন্ট প্যানক্রিয়াসের। আর এখন তোমরা আরেকটু ভালো বুঝবে, আমি সেদিন ইচ্ছা করেই ওই যে প্যানক্রিয়াসের অ্যান্টেরিয়র বর্ডারে যে দুইবার এসে পেরিটোনিয়াম ফেরত যায়, এই কথাটা আমি প্যানক্রিয়াস পড়ানোর সময় বলি নাই, কিন্তু আমি এটা আবার বলার সময় বলেছি, তাই না? খেয়াল করেছো কিনা যে পেরিটোনিয়াম পড়ানোর সময় এই জায়গাটা আমি জোর দিয়ে পড়েছি, কারণ এখন তোমরা বুঝবে, তখন তোমরা ইউ আর অ্যাকচুয়ালি নট ইন এ স্টেট যে তোমরা এটা বুঝতে পারবে যে প্যানক্রিয়াসের অ্যান্টেরিয়র বর্ডারে যে দুইবার আসে পেরিটোনিয়ামটা, এটা
জি স্যার।
তোমাদের
ও স্যার মানে ট্রান্সফার মেসোকোলনটা।
হ্যাঁ হ্যাঁ হ্যাঁ, এগুলো কিন্তু ধরা হবে একদম প্রত্যেকটা জিনিস, অ্যান্টেরিয়র বর্ডার, তারপরে সুপিরিয়র বর্ডার, ইনফেরিয়র বর্ডার, তারপরে হচ্ছে এন্টার সারফেস, পোস্টেরিয়র সারফেস রিলেশন, আনসিনেট প্রসেসের রিলেশন, টিউবারোমেন্টালের রিলেশন, পোর্টাল ভেন কোথায় ফর্মেশন হয়, অ্যাবডোমিনাল এওরটা কোথায় থাকে, ইনফেরিয়র ভেনা কাভা কোথায় থাকে প্যানক্রিয়াসের, এগুলো একেবারে মাস্ট নো। আর ডিরেকশনটা যে আপওয়ার্ডস, তারপরে স্প্লিনো লিনোরেনাল লিগামেন্টের মধ্যে দিয়ে কি হয়ে স্প্লিনে চলে গেল, এইগুলা টেইলের মধ্যে কোন জিনিসটা বেশি থাকে, এগুলা একদম মানে ভালো করে জানতে হবে। তাহলে আমরা এখন চলে আসি, অনেকেই মোটামুটি চলে এসছে মেল রিপ্রোডাক্টিভ সিস্টেম। এখন so before starting anything regarding male reproductive system, I'd like to share or discuss some points with you. First of all, actually I'm not only a teacher, I'm a father as well, right? My elder son is 14 years old and younger son is 10 years old. So they are not that much in that to you. I hope you are all 19 or 20 by your age. So actually they could be your younger brothers, right? So as a guardian, I don't like that I'd be as a we'd be discussing these things in heterogeneous population, like female students are there, male students are there. But at the same time, I'm a teacher as well. So it is my duty to discuss everything and show everything, discuss everything that you need to be a good doctor. If I feel shy or if I think that, okay, they will learn these things, maybe you would be missing, and that would be a disastrous consequence when you go to your patients. Even if in your own life, reproductive system is so important, and I'm coming to that. So this is my first point, that you would be showing some pictures which would not be shown in heterogeneous groups, which would be discussing some points which will not be discussed in heterogeneous groups other than this arena. Me, myself, will never ever do that. So this is my duty and I'm exerting my duty. That's all. First thing. Second thing is that these viscera, though you are not seeing the visceras, these are very sacred parts, very prestigious and very personal parts, private parts of every human being, be it a male, be it a female. So let us honor them and pay due respect to them. And what happens, I can tell you one story, and that is a real story. One of my friend, he is a postgrad doctor. but he had committed a very heinous work during our first year, that he used the vagina as an ashtray. He put the butt of the cigarette in the vagina just to, maybe he wanted to show the smartness to the girls or something like that. But it reached to the principal sir, and principal sir wanted to rusticate him from the college, and we all requested him, and this will never ever happen. And because we were the first batch, that's why he said, as you are only the first batch, you don't know the etiquettes, no one is to teach you the etiquettes, that's why I am sparing you, or else you would have been rusticated for this. But the best teacher has cursed him. You will never be able to earn your breads and butter from this knowledge. If I am a good teacher, if I am a teacher, you have taught you some few words, even a single word to you, you'll never be able to earn your bread and butter from this profession. And that happened. He could complete the post-graduation degree, but he still, after, and we are at 50s, 50, 47, we are running, still he is not earning anything properly. He has no fixed income, because though he has got a postgrad degree, he has joined a private institute as an assistant professor. Within 1 month, he was sacked. He joined a clinic. Within 2 months, he was sacked. He even joined his government service. And so after the completion of the tenure, he had to give up the job. Now he has made a private chamber at his residence and is practicing there. But no institutional job, no fixed job still at 47. That curse directly fell upon him of the teacher. So I request you, never be over smart. Please do pay homage to the viscerals like the vagina, the penis, and other parts that you will handle, but with due respect, first of all. Secondly, consider that it could be my own. I don't know whether I'll have a good funeral, a befitting funeral. I don't know. You don't know whether you'll be, who knows where we'll die. Can you tell me that you will have a befitting funeral? For sure? No, you can't tell that. In 1971, many famous persons of Bangladesh had died out of misery and dishonor. You have seen them. So nobody knows where our body parts will be left. So let's not hope, let's hope for the, with our all might, that this doesn't happen to me, that I would be with the person, without anonymous person, and my bodies will be used if I don't donate it. If I donate it, that's a different issue. But maybe my body would be here after 5 years or 2 years or 3 years. Okay, you don't know. So please be on, please put your all hands together and give your respect, all your respects to these viscerals. Okay, this is the first and foremost request to you. And let us extend it further. Let us be gentle, be polite to everyone around us. Let us be polite with the females. You see, so many bad instances are done by the doctors. Just 2 days earlier, a doctor has been put behind the bar due to the conviction of rape case against his patient. And this is not only happening in Bangladesh, even the United Kingdom, United States, these are happening. So don't take the undue advantage of your profession. Please, this is my humble request. You can do many things if you want to, as you have got many chances. But please be respectful to others. Okay, so let us start with these. This is my plea to you as a teacher, as a senior professional, whatever you think, as a guardian, whatever you think, this is my plea to you. Okay, that's the male reproductive system.
স্যার আজকে
And see,
সাউন্ড অন্য দিনের মতো ক্লিয়ার নাই তো।
এখন এখন এখন
জি ম্যাডাম, জি স্যার এখন একটু ক্লিয়ার।
আচ্ছা আচ্ছা, ঠিক আছে, বুঝতে পারছি, এটা একটু নিচে নেমে গেছে। তাহলে আমি কি এসিটা বন্ধ করে দিই, 1 সেকেন্ড একটু ওয়েট করো। এখন কি ক্লিয়ার? এখন কি ক্লিয়ার?
জি
Yes,
স্যার,
sir.
আগে ক্লিয়ার।
আচ্ছা ঠিক আছে, দেখো আমরা I always say that two things are very essential for the survival of the individual: eating. You have to survive, you have to eat if you want to survive. So individual must survive by eating, and for survival of the species, mating. Right? So this is the purpose of the reproductive system. In short, it is the for the survival of the species. Without mating, next generation will not come. That is the target of the nature, to have a reproductive system and to stimulate or to engage its individuals in mating. So this is the purpose of the reproductive system for the survival of the species. Okay. Next, I always tell you, Visram Singh is a very good book, but sometimes it is very much contradictory to itself. It has written that I've taken it from Visram Singh. You see, the male genital organs are divided into two groups: internal and external. And the external genitals or like these internal. Sorry, the external are penis, scrotum, testes, epididymis, spermatic cord. Fine. Next, you see, when they are talking about the internal genital organs, the same book, they are rating testis and epididymis, prostate, bulbourethral glands, seminal vesicles, ejaculatory duct and penis, and vas differentia. What a clumsy situation. Can penis be an internal genital organ in any way?
নো স্যার।
No, never ever. So this is a wrong classification. So please be careful about these, because Vishram Singh is, I have not personally met him, but from his write up, I can understand he is a very much dogmatic person. Whatever he thinks correct, he goes on saying, though others don't agree with him, he doesn't bother. So be careful about. If you tell that penis is an internal genital organ, you'll doomed to fail there. Okay, so never ever do this. So what are actually, so let us come to some definitions like genitalia, because you have come to genital organs or genitalia, right? So what is the meaning of
স্যার আমাদের
genitalia?
এডিশনে তো শুধু এক্সটার্নালি দিছি স্যার।
না না, ইন্টারনাল আছে পিছনে, এই যে চ্যাপ্টারের পিছনে আসো, যাও পিছনে চলে যাও, এটা এই যে ইন্টারনাল আছে হচ্ছে গিয়ে আবার ইন্টারনাল আছে হচ্ছে গিয়ে ওই চ্যাপ্টারে, এই যে এখন তো পিছনে যেতে আমার সময় লাগছে, এটা হচ্ছে পেরিনিয়াম, না পেরিনিয়াম না, সরি, এই আচ্ছা আচ্ছা বাবা, এই যে চ্যাপ্টার 17 মেল জেনিটাল অর্গানস, ওখানে যাও, ওখানে ইন্টারনালে দিয়েছে, হ্যাঁ আবার দিয়েছে, দেখো চ্যাপ্টার 17। আমার এডিশন কোনটা? আমারটা তো মোটামুটি লেটেস্টই মনে হচ্ছে, সেকেন্ড এডিশন যেটা। তোমরা কোনটা পড়ো, থার্ড পড়ো নাকি?
থার্ড এডিশন স্যার।
আচ্ছা যাই হোক, তাহলে ওখানে যদি ঠিক থাকে তাহলে তো ভালোই। আমার কাছে সেকেন্ডটা আছে, এই জন্য আসলে লেটেস্ট বই পড়তে হয়। এনিওয়েজ, তাহলে দেখো কি বলছি আমি। জিনিটালিয়া, এটা মানে কি জিনিটালিয়া? এই দেখো মেরিয়াম ওয়েবস্টার, একটা জিনিস খেয়াল রাখবে, মেরিয়াম ওয়েবস্টার ইজ দ্য ডিকশনারি ফর নর্থ আমেরিকান ইংলিশ। So in Merriam-Webster, it has been written by definition of the genital, the organs of the reproductive system, especially the external genital organs, right? Again, in Cambridge Dictionary or Oxford Dictionary, they are also saying this is the dictionary for British English, and they are also saying the external genitalia, outer sex organs, especially the penis or vulva, particularly the external genital or private parts. So in common usage, genitalia means external genital organ. When they mean the people around the world, when they mean they utter genitalia, they actually meaning the external genital organs. But in medical usage, we use these genitalia for both the internal and external structures. right? That is the difference. In medical literature, we use the genitalia term for both internal and external genital organs. But in common usage, you'll see that they use it for external genital organ particularly. Okay, so even in Cambridge, it is the penis and scrotum or vulva. What is, so these next you are getting another term vulva, another term pudendum. What are these the meaning? Pudendum. You will get internal pudendal nerve, internal pudendal artery, external pudendal nerve. So what is pudendum? So pudendum is the external genital organs, especially of those of the females or vulva. So pudendum, by pudendum, we actually mean external genital organs and particularly the female one, right? Though male has got the pudendum, males have got the pudendum, but usually it is meant in common usage by the laymen as the female genital, external genital organs or vulva. Same, they have given 4 definitions, but usually this is used by the general people. So what is vulva then? So vulva is the plural of vulvas or vulvae. If, plural is this, and this is from actually female sex organ, external sex organs like mons pubis, labia majora, minora, clitoris, vestibular bulbs, vestibular urinary meatus, and vaginal opening, hymen, and Bartholin's and skin is vestibular glands. So these are altogether called vulva. So now you are getting 3 terms: vulva, pudendum, and genitalia. Is it clear to you? In medical usage, I am repeating again, both the internal and external genital organs are called genitalia, but in common usage, people use genitalia for external genital organs. Next, the pudendum. It is the external genital organs, and in common usage, people want to mean the female external genital organ. But in anatomy, we use this pudendum for both the male and female external genital organs. Again, vulva. Vulva is only used for female genital organs, external female genital organs. So gradually we are reducing to a point. Okay, but we are not going to deal with these vulva today or the female genital organs. Rather, we'll go to the male reproductive organs. Let us come to them one by one. These 2 are finally the external male reproductive organs, the penis and the scrotum. Okay, and the internal organs are testis and epididymis, vas deferens, seminal vesicle, ejaculatory duct, prostate, and bulbourethral glands. Okay, so this is finally what you will tell in the exam. Which one are the external genital organs of the male? These are penis and scrotum, and these all are internal genital organs. No doubt about that. Don't never ever say penis is an internal genital organ. Okay, next. Why? Testis is an internal, though it is hanging outside the body, but it is actually inside the body cavity. It is the scrotum, inner lining of the scrotum is an extension of the abdominal wall. So it is regarded as the internal genital organ. Okay. Next, which one of, sorry, I've got a cold last night. So which one of these is the primary sex organ? Can anyone tell me?
So testis.
Very good. Testis. Testis. Never ever. Some have the temptation to say penis is the male primary sex organ. No, it's not. Without penis, human beings can be produced by test tube babies, you know, with the sperm is taken from the testis and directly inserted into the test tube with the female ovum, and when it is fertilized, then it is taken to the mother's womb, that is uterus, and the baby is born. So penis is not necessary for reproduction, but testis is. Definitely it is. Okay, so that's why it is the primary sex organ. Okay, next. These 2, the prostate and bulbourethral glands, are called accessory glands, sex glands or accessory sex glands. Why? Because prostate and bulbourethral glands, yes, they do have some functions, but without even these glands secretion, the fertilization or the reproduction can be possible. So they are called accessory, but they have got very important role but we can spare if needed the prostate and bulbourethral gland. That's why they are called accessory sex glands. Okay, so is it clear to you so far? Which one are the
Yes,
male
sir.
external and internal? Which one is the primary sex organ, or which are the accessory sex glands of male? Okay. Now, I'll tell you one term because you will be needing it to know and refer to it many times during the study of male reproductive system, female reproductive. This is one term, perineum. That will be dealt in different class in detailed, but just have a definition, and so that you can locate the organ. And please be prepared that we'll be showing some sexually explicit figures, but that is very much important to know and see. First of all, the definition of the perineum. From here you can see, you know by this time, the pelvic inlet, pelvic, the brim, and pelvic inlet, pelvic outlet, you know these things, right? From the bones you have studied. Okay. So from the pelvic inlet to the pelvic outlet, it is called the true pelvis, and above it, it is called the false pelvis. You know these things. But you see, there is a diaphragm that is called pelvic diaphragm that is formed by the levator ani and coccygeus muscle, right? So levator ani and coccygeus muscle is forming a diaphragm that is called pelvic diaphragm. And below this diaphragm, the part of the trunk is called perineum. So this part is perineum. This part is perineum. Okay. So what is the definition of perineum? Write it down. The lower part of the trunk below the pelvic diaphragm is called perineum. Girl students, if you fail to answer and know about perineum, you're supposed to fail. Even the boy
Sir,
students.
আরেকবার
The lower part of the trunk below the pelvic diaphragm. So below the pelvic diaphragm, you see there is a trunk part, right? From the pelvic diaphragm to the pelvic outlet, this part is actually the pelvic diaphragm. But you can't have the idea how it looks like and where it is located from this figure. So let us add another figure with this one. This is actually the region, the diamond-shaped region present in both the males and females. This diamond-shaped region is the perineum, which is present here in the female and in the male, right? So now you can locate this part of the trunk is below here. And now you can match this part has got some very important openings in female, the urethral orifice, the vaginal orifice, and the anal orifice. But in case of male, it is the anal orifice, but urethral orifice is located within the penis. But you must refer to this region and you must know the location of this region, perineum. I'm not going to detail anything further about this, just to have an idea how it looks like in cross section, I mean the longitudinal section, and how it looks like in real body. What is the location of perineum? Okay, so now I'll go for the pictures that you'll be needing to know. The scrotum. Let us start with the scrotum now. I'm not starting with I'm not telling about anything about the penis because you are not in a state to understand the penis right at this moment. So I would like to start with the scrotum. You know, this is the scrotum, a sac. Okay, so this sac has got, this sac-like structure has got some layers, and actually it is a two compartmental sac which unites by embryologically to one sac. So it's actually two compartment united together, and now it is called the scrotum. In female, they are separated and form the labia majora. Same thing, the scrotum is separated and that form the labia majora, but in case of male, it unites. The embryological explanation I'm not going to give, where probability is arising, but this is in short about the arrangement. Now you can see there are some layers of the scrotum as in this figure: screen, then the Derdos muscle, external spermatic fascia, cremasteric fascia, and muscle and fascia, and internal spermatic fascia. So I have told you these things in details. What is external spermatic fascia? You know it. The continuation of,
External
External
oblique
oblique.
muscle.
yes, aponeurosis of the external oblique aponeurosis. The cremasteric fascia is the, and muscle is the
Internal.
cremasteric
internal oblique.
hair. Detached U-shaped loops of the lower loops of the internal oblique muscle with their intervening fascia holding them. Internal spermatic fascia is the continuation of the
Fascia
fascia
transversalis.
transversalis.
Transverse transversal.
So you can compare the layers of the anterior-abdominal with the layers of the scrotum. You can see the skin is skin. Superficial fascia is replaced by darkest muscle and is very tightly adherent to it. That's why the scrotum is very much corrugated or zigzag in when it looks like, right? Then the external oblique is replaced by external spermatic fascia, internal oblique by cremasteric muscle and fascia transversus abdominis. This is no corresponding layer in the scrotum. There is no transversus abdominis muscles corresponding layer in the scrotum, but fascia transversalis is replaced by internal spermatic fascia. So this is in short about the layers of the scrotum. And now you can see the scrotum has got a raphe. I've told you there is a raphe. I told you. Did I tell you? No. You can see there's a joining between two layers of the scrotum. Okay. So the scrotum actually it will be elaborated in the testis. When we'll be discussing the testis, you see the skin, then the dartos muscle, then the cavity, and the this is the septum of the scrotum, where two halves have united. And usually left scrotum is lower than the right one because the left spermatic cord, what is this? I'll be telling you. Well, you know it by this time. Still, spermatic cord is longer. That's why the left scrotum is lower than the right one. Okay. Next, very important and very interesting, the nerve supply of the scrotum. You'll see that the anterior part is supplied by the ilioinguinal nerve having the lumbar one, and the genital branch of the genital femur that is also having the lumbar one. But the posterior scrotal branches of the scrotal, this region, the posterior region is supplied by the cranial nerve and the nerve, posterior cutaneous nerve of the thigh, which are both having the root value of sacral 3. So there is a discontinuation. You see, this is called the ventral axial line, and that actually denotes the ventral axial line of the lower limb. Similar to that one we have studied in the upper limb, C5, 6, 7, 8, T1 is giving rise to the bud for the upper limb, right? Forming the brachial plexus. In the same way, there is a discontinuation from L1 then straight forward to S3. What about the L2, 3, 4, 5, sacral 1, 2? They have actually migrated to the limb bud, lower limb bud. So this is the demarcation line from where actually from this testy, the scrotum, the anterior tooth 1/3 and posterior 2/3 indicates that line from where actually the limb bud for the lower limb have emerged. Very interesting one. That's why this is very much discontinuous. Here it is L1, here it is S3. Like here in the thoracic region, up to it is C4, then suddenly it is T2. Why? Because 5, 6, 7, C5, 6, 7, 8, and T1 has gone to the upper limb. Similar way, this is the line of demarcation. Okay? Got it? And the scrotum has got cremasteric fascia, and the cremasteric muscle, dartos muscle is an involuntary muscle, and cremasteric muscle, though it's a voluntary muscle, but it is mediated by a reflex that is called cremasteric reflex. If we stroke in the upper medial aspect of the thigh, the cremaster muscle will contract. That is called cremasteric reflex. And you know, reflex is an involuntary response to any stimulus. So actually this cremaster muscle has got some involuntary components, involuntary reflexes. Okay. So with this, actually, we can conclude about the important things about the scrotum, and we will study in details, because if I want to detail it further, and one thing that the scrotum, you know, the tunica vaginalis, I've told you, tunica vaginalis is what? It is the similar to peritoneum, and it has inserted into, and actually it is forming the lining. And cavity of the tunica vaginalis, we'll study it when we'll be discussing the testis right after this. So this would be that you see this term cavity of the tunica vaginalis. You might wonder what is this. I'll be elaborating it right after this slide. Okay, so in short, this is about the scrotum. You'll study the blood supply in yourself. Now come to the what are the contents of the scrotum. The most important one, as I've told you, this is the primary sex organ. Male reproductive organ is the testis. And you know, the testis has got two poles, upper pole and lower pole. It is placed obliquely, and the upper pole is slightly anterior to the lower pole. And as I've told you already, that the lower testis remains a bit lower, or the left testis hangs a bit lower in the scrotum due to the longer spermatic cord. Now, come to the point. What is tunica vaginalis? Sorry, extremely sorry. You see, there are three layers of the testis. One is tunica vaginalis, then tunica albuginea, then tunica vasculosa. So coverings of the testis are three: tunica vaginalis, tunica albuginea from outside to inside. This vaginalis has got two layers. It is the parietal layer and visceral layer. So parietal layer covers the inner surface of the scrotum, and the visceral layer tightly adheres the testicular structures. Okay, now there is a potential space between this the parietal and visceral layer of the tunica vaginalis. And actually, tunica vaginalis is nothing but the continuation of the peritoneum into the scrotum, that is called the tunica vaginalis. And as it is the continuation of the peritoneum, it will have the similar arrangement like the parietal layer and visceral layer. And the parietal layer will be covering the inner surface of the scrotum, and the visceral layer is this one, which tightly adheres the testicles, and there is a space between these two that is filled up by a potential space, right? So now this tunica vaginalis visceral layer is covering all the aspects of the testis, but posterior side is not covered by the testis. So what happens there? Actually, you will see that when it comes, tunica vaginalis is the visceral layer is tightly adherent to this surface, but when it reaches the posterior border, it is continuous with the parietal layer of the body of the epididymis, you can say, posterior layer of the body of the epididymis. This is the epididymis. What is epididymis? I'll be telling you. So it is continuous with the body of the epididymis on the medial surface, and on the lateral surface, it forms a recess that is called the sinus of the epididymis. What do you know? You have asked me what is recess in the last class. I told you this is a pocket, right? That is the thing. Actually, there is a pocket-like gap. You can see there is a pocket-like gap in the testis. This sinus of the epididymis, which separate this pocket-like gap, separates the lateral surface from the medial surface, and it is a gap on the lateral side, and that denotes the when we hang the testes by the spermatic cord, the sinus of the epididymis remains on the lateral side, and that is how we determine the side of the testis. So this sinus is nothing but a recess. That is, the visceral layer is outputting, making a intern over it and making a pocket-like structure that is called the sinus of the epididymis. Okay.
Could you just repeat the last thing?
Sir, side determination.
Side determination হচ্ছে আমরা যখন will hold the testis with the cord, বা আমরা যদি আমরা ধরি এরকম করে testisটাকে ধরি আমরা, তাহলে the side which has the sinus of the epididymis.
Sound clear na sir?
The sinus of the epididymis যখন থাকবে, এই যে দেখো এখন ক্লিয়ার,
জি স্যার
স্যার আগে
হ্যাঁ,
শুনতে
এখন
আবার
পারেন
একটু রিপিট করলে ভালো হয় স্যার
আচ্ছা এটা হচ্ছে কি আসলে আমার সাউন্ড ঠিকই আছে, নেট কানেকশন ইজ ভেরি পুয়ার হিয়ার,
জি
এই
স্যার
জন্য বারবার ফল করে যাচ্ছে। নেট কানেকশনটা ভেরি পুয়ার, বারবার দেখাচ্ছে ইউর কানেকশন ইজ আনস্টেবল, এই জন্য এরকম হচ্ছে, তোমরাও দেখতে পাচ্ছ স্ক্রিনে আসছে বারবার, এই জন্যই মনে হয়, আদারওয়াইজ এটা তো ভালোই আসার কথা। এনিওয়ে, তাহলে দেখো এই ল্যাটারাল সারফেস অফ দ্য টেস্টিসে এই ভিসেরাল লেয়ারটা করে কি এরকম, ইট মেক্স আ ফোল্ড আপন ইটসেলফ এন্ড ডাজ মেক এ pocket like structure that is called sinus of the epididymis, which separates the lateral surface from the medial surface, and this is the epididymis, a coma like structure which has got a head, a body and tail. Now let us get into the testis. And before that, we have told you there are two more layers. Tunica vaginalis, we have already discussed. Tunica albuginea is a connective tissue layer, which is, the name implies it's albuginea, that's whitish structure that is present beneath the tunica vaginalis. And the innermost layer is the tunica vasculosa. From there, actually, blood vessels enter into the substance of the testis, right? So these are the three layers: tunica vaginalis, has got the parietal and visceral layer. Then this whitish one is the tunica albuginea, and this reddish one is the tunica vasculosa. And actually, this tunica albuginea is very thin and adherent, but in the posterior aspect, it is very thick, and that thick area is called mediastinum testis. This area is called the mediastinum testis. This is the anterior side, this is the posterior side of the testis. So this thickened tunica albuginea is called mediastinum testis. But from other areas, the septum enters into the substance of the testis and divides it into 200 lobules, should we rather say. This is one lobule, this is another lobule. Apical lobules, this is a triangular lobules, pyramidal shaped, which apexes are towards the posterior end or mediastinum testis. So these are the lobules. In
স্যার
each
লোবিউল
testis, there,
কোনগুলা স্যার
এই যে এই একটা দিস ওয়ান ছবিতে দেখতে পাচ্ছ, এই যে বাম পাশের ছবিটা দেখো, আমার কার্সার যেখানে, এই যেটা, from these tunica albuginea, septum enters. Septum, this is one septum, this is another septum, this is another septum, this is another septum, and this is the posterior end where the
স্যার আপনার কার্সর দেখা যাচ্ছে না স্যার
এই যে কার্সার, এই যে
আচ্ছা
এখন দেখা যাচ্ছে
ল্যান্ডস্কেপ মোডে
এই যে এই
এখন
ছবিতে
দেখা
দেখো,
যাচ্ছে
বাম
ও জি
পাশের
স্যার
ছবিতে,
বাম পাশে ছিল ও আচ্ছা
হ্যাঁ বাম পাশে।
আবার বলে
মোডে
একটু
থাকলে
বলেন
বোঝা যায়।
একটু ফলো করো, কোন পাশের ছবি থেকে আমি কোন পাশে যাচ্ছি এটা ফলো করো, আর না হলে আমি বলে দিব এরপর থেকে কোন ছবিটা দেখবে। আচ্ছা দেখো, এখন বাম পাশের ছবিটা দেখো, এই দেখো, এই যে এটা হচ্ছে গিয়ে thickened হয়েছে to form the mediastinum testis, and from the tunica albuginea it is entering into the substance and dividing into lobules. This one is one lobule, this is another, so altogether there are 200 lobules, and each lobule, within each lobule there is 1 to 3 seminiferous tubules. The structure of the seminiferous tubule, I can't elaborate it further because it would be discussed in details in histology classes, but that is where actually the spermatozoa and sperm is formed. I'm not going to the details of these blood testis barrier. Many interesting things are there. You'll know about that in histology classes. But from now on, you learn that in each lobule there is 1 to 3 seminiferous tubules. So as there are 200 lobules in each testis, and sorry, there in each lobule there is 1 to 3 um, seminiferous tubules. So altogether in each testis, 400 to 600 seminiferous tubules, and these 400 to 600 seminiferous tubules converge to form 20 to 30 straight tubules. These are, you can see on the left figure, these are called the straight tubules, and these straight tubules join together to form a network. এই যে দেখো, কালো কালো বাম পাশে দেখো, আরো বড় করব, আচ্ছা দিস, সরি, এর বড় করা যাচ্ছে না, দেখি আমি বড় করতে পারি কিনা,
আমরা বড় করে
না এটা
দিছি
আর বেশি, এই যে এখন এখন দেখা যাচ্ছে না, আচ্ছা দেখো, এই যে দেখো,
আমার বড়টা একটা
এই যে এগিয়ে ছিল, হ্যালো, কিছু বলছো, হ্যালো
না স্যার
হ্যালো,
ভুল সাউন্ড এসে পড়ছে জি স্যার শুনতে পাচ্ছি স্যার
আচ্ছা ঠিক আছে, তাহলে দেখো, seminiferous tubules are forming straight, these are called straight tubules. Okay, these straight tubules are joining to form a network, this is called retitestis. Next, at the upper end of the posterior side of the mediastinum testis, this reti testis forms 12 to 20 efferent ductules. Efferent ductules. So these blue ones are the efferent ductules. Let me again tell it again. These are seminiferous tubules. Then this is straight tubules. Then this is the green one is the reti testis. Reti means network. Network. Everywhere you find the reticular, that is network like. Then this reti testis is converting to the efferent ductules, and these efferent ductules joining to form the head of the epididymis, which is a convoluted structure of head of the epididymis, which is actually the convoluted structure. But at the lower end of this head, it becomes a single duct of the epididymis. You see, this convoluted one is converting into a single duct of the epididymis again. So the different ductules are forming a convoluted structure that is called the head of the epididymis, but at the lower end of this head, it is becoming again a single duct of the epididymis, which actually folds upon itself to form the body, and the lowermost end is continuous with the, that is forming the tail, is continuous with the vas deferens or ductus deferens. It is very important to understand because there would be MCQs. Trace the pathway of sperm from the seminiferous tubule to the exterior. Then you have to tell it is formed in the seminiferous tubule, then it goes to the straight tubule, then it goes to the reti testis, then to the efferent ductules, then to the head of the epididymis, then body, then tail, then it goes to through the ductus deferens. Then I'll be telling you where it goes. So this is how you must be able to trace all these components one by one and sequentially, right? Okay. Now, what happens to this? The sperm is formed. It has been formed in the seminiferous field, gone to the straight tubules, then to reti testis, then to efferent ductus, then to epididymis. Then it is passing through the vas deferens. Now, vas deferens is not alone. It is covered by some other structures that altogether forms the spermatic cord. And from where to where the vas deferens is called, spermatic cord is from the upper pole of the testes, that is from here to the deep inguinal ring. It is called the spermatic cord. And the spermatic cord has got some, and the blood supply. Okay, fine. Before going to the blood supply and the spermatic cord, let us give few comments on the blood supply of the testis. You know, the testis is getting its blood supply from right testicular artery and left. Both are coming from the inferior vena cava, abdominal aorta directly, and it is when it comes close to the external iliac artery here, it enters, follows it, and enters into the inguinal canal through the deep inguinal ring, then exits through the superficial inguinal ring and goes to the testis. হয়েছে? এটা বুঝতে পেরেছো? But there is difference.
স্যার এটা আবার একটু বোঝালে ভালো হতো।
আবার বলবো? আচ্ছা ঠিক আছে. Both the right and left testicular arteries arise directly from the abdominal aorta, and it goes and the downwards, and when it reaches the external iliac, this is the common iliac and external and internal. So that has not been shown, but when it reaches the external iliac, it follows it to the deep inguinal ring. This is the deep inguinal ring, and this one is the superficial inguinal ring, and this is the inguinal canal. Then it enters through the deep inguinal ring and passes through all the way through the inguinal canal, emerges through the superficial inguinal ring to reach the testis on both sides. Okay, but for the venous drainage, there is a difference. The testicular veins join to form a pumpiniform plexus, which is sometimes 3, sometimes 2, sometimes it becomes 1. And interestingly, the right one directly goes to the inferior vena cava, but the left testicular vein goes to the right renal vein. Why? Because the right, inferior vena cava is to the right. That's why the right testicular vein finds the inferior vena cava easily, but it can't find the left. The left testicular vein can't find the inferior vena cava. That's why it gets the renal vein straight and is draining there. So this is one very pet question by the teachers. And next is the supply of lymphatic drainage. It goes to the pre-aortic and para-aortic lymph nodes. So you must know this, and from this figure it is very much clear. But one thing you see, this is called the pumpiniform plexus of the veins, and it is within. This is the vast difference, and these are the other contents of the spermatic cord. Spermatic cord has got a covering which has got three coverings: external spermatic fascia, internal, I mean, the cremasteric fascia, and the internal spermatic fascia. You know it, the spermatic cord, right? So in the there is continuing along with, and there are some more structures like the testicular artery, like the artery of the vas, the pumpiniform plexus of the vein, and the lymph vessels of the testis, and ilioinguinal nerve, right? So these forms the contents of the spermatic cord, and that is very important to know. An extension from the upper pole of the testis to the deep inguinal ring. This is the length of the spermatic cord, right? From the upper pole of the testis to the deep inguinal ring is the length of the spermatic cord. And these, what is the function of this pumpiniform plexus? Why there are so many veins around these vessels? Have you any idea? It reduces the temperature. It absorbs the heat and thereby reduces the temperature of the testis. Why? Why? Because the testis was an
Optimum
intra-abdominal
temperature.
organ. Testis was an intra-abdominal organ initially, but it has descended to the scrotum. It has descended to the scrotum. Why it has descended to the scrotum? Why? See, this is the process of descent. I'm not going to the details of it, but just see, this is one thing called gubernaculum testis, which is attached to the lower pole of the testis when it is in the abdomen, and another pole of the gubernaculum testis is attached to the anterior wall of the scrotum, and it guides it widens the inguinal canal, so that due to other factors, sorry, extremely sorry, it can come to the scrotum. This is called the gubernaculum testis. And this is a very common question. What are the factors for descent of the testis from the abdominal cavity to the scrotum? One is gubernaculum testis, another is intra-abdominal pressure, then other factors are there. And what the students usually forget to tell is the hormones. You'll know that from the testis, so many factors I'm not going to tell, because students are very much affectionate to, are very much fond of telling the gubernaculum testis, which actually has got no role in pulling down. Rather, it works as a guide. This is taken from Dotto's anatomy. It works as a guide, and that actually widens the inguinal canal so that the testis can come through this widened inguinal canal to the scrotum. Okay, but interestingly, which one is the most important? Do you know? Is the hormones produced by the testis itself. They actually program the shrinkage of the gubernaculum testis, the widening of the inguinal canal. Everything is programmed by the hormones, and that hormone is the main factor for descent of the testis. So we can say that testis is actually descending by its own mechanism of hormones. But what is the role of gubernaculum? It guides to and widens the inguinal canal.
Inguinal canal.
Inguinal canal. Now, one question. You have seen the testicles of horse. You have seen the testicles of course, human beings. You have seen in the scrotum, in the ox. But what about the elephant? Have you ever seen?
No, sir.
No, sir.
Why?
Sir, it is inside the body.
Just imagine, elephant's testis would be half what size? It would be like a football, right? So if it runs within the jungle, what will happen? This big thing will be caught and it will die out of pain, right? That's why nature is so cunning and so methodical that there is no gubernaculum testis in the elephant. That's why elephant's testis is intra-abdominal. Isn't it interesting?
Yes, sir.
So that is how nature accommodates that not always everything will happen. The gubernaculum testis is not present in the elephants. That's why their testis remains within the abdomen. So what is the purpose of these testes coming to the scrotum? Why? It could have been easily within the scrotum. But you know, the temperature of the abdomen is higher than the scrotum. The scrotum loses the temperature by, as I've told you, by the pumping plexus of the veins in the spermatic cord, as well as there is dissipation of heat from the scrotal skin, and there are so many glands in, as it is a corrugated skin, there are so many glands, which sebaceous gland and sweat glands, so this dissipates heat and thereby actually decreases the temperature of the scrotum than the temperature in the abdomen. That's why and that high temperature is not feasible for the spermatogenesis to occur. In that case, if that testis is mistakenly or due to wrong procedure is held within the abdomen, that is called cryptorchidism or undescended testis, there will be ejaculation would be there, but that sperm is not viable to is not able to give birth. That sperm is not able to fertilize. That is the problem. Agiospermia would be there. Agiospermia, there would be seminal fluid,
Absent of
but there would be no sperm.
sperm.
Right, that is the problem. So cryptorchidism, that means it is held up somewhere. Crypto means churi, stealing. So it has been stolen. The testis has been stolen from the scrotum within the abdomen. That is what it's called cryptorchidism. You'll study it yourself. Okay. So let us go to the next point. Okay. So let us now follow the vas difference. You can easily follow the course of the vas difference. This is the superficial inguinal ring, and this is a deep inguinal ring. It has started from the, as I've told you, from the upper pole of the testis, and now it is going inside and through the inguinal canal, and on reaching the deep inguinal ring, it makes a sharp in-turn lateral to the inferior epigastric artery and goes to the pelvic wall. And when it reaches the pelvic wall, what happens? You see from here, this figure. This is the deep inguinal ring of the previous picture. Then it has gone to the lateral pelvic wall, and when it crosses to the ureter, and then it reaches the posterior surface of the urinary bladder. You have studied it. I think you have studied it all of, not yet. If not, in the next class we'll be studying it. We have to finish it. Then
স্যার 12টা বাজে স্যার।
হ্যাঁ আমরা শেষ করে দিচ্ছি, এইটুকু বলে আজকের জন্য শেষ করে দিচ্ছি, কারণ অ্যাকচুয়ালি অনেক কিছু আছে। মেল জেনিটাল সিস্টেমের মাত্র আমরা এগুলো বলেছি, তারপরে সেমিনাল ভেসিকল আছে, তারপরে প্রস্টেট আছে, এগুলো সবই বলতে হবে। হ্যাঁ, এগুলা না জানলে হবে না। তারপরে পিনেস আছে, এগুলাও জানতে হবে। আমরা আজকে সোফার উই উইল বি ফিনিশিং আপ টু দিস। তাহলে এটা কি করছে? পোস্টেরিয়রলি, এটা এট দ্য পোস্টেরিয়রলি ইট ইজ টার্নিং এন্ড জয়নিং দ্য duct of the seminal vesicle to form the ejaculatory duct, which opens into the prostatic part of the urethra. This is the urethra. So this is the prostatic part of the urethra. This is the membranous part of the urethra. This is the penile part of the urethra. So it is opening into the prostatic part of the urethra. So up to this is called spermatic cord. Then it is not spermatic cord. This is only the vas. Ductus difference. And you can see it from this picture here, ureter, and going to the posterior surface of the urinary bladder and joining with the seminal vesicles on each side to form the ejaculate. This is the duct into the posterior part of the urethra. Right, and from there, actually, this pathway is common for both the urine and sperm.
সাউন্ডের সমস্যা হচ্ছে স্যার।
It was solely for the sperm.
শোনায়
স্যার আর একটু রিপিট করলে ভালো হতো।
বুঝতে পেরেছো?
না স্যার, সাউন্ডের সমস্যা ছিল স্যার। জি স্যার, আর একটু বললে ভালো হয় স্যার।
আমরা ক্লিয়ার
তাহলে শেষ করে দিব, এন্ড করে দিব।
না স্যার, শুনতে পারিনি স্যার আগেরটা।
আগামী ক্লাসে
স্যার ইনগুইনাল ক্যানেল থেকে কিছুই শোনা যায় না ঠিক মতো।
জি বলো তো আবার, কি শোনা যায় নাই?
স্যার ইনগুইনাল ক্যানেলের পরে যে ইউরেথ্রা বললেন না, যে কি কানেক্ট হচ্ছে
শোনা
স্যার,
যায় না, স্যার।
ওই জায়গায় স্যার সাউন্ডের সমস্যা ছিল আর কি বলতে।
ও আচ্ছা, ইনগুইনাল ক্যানেলের পরে, আচ্ছা ইনগুইনাল ক্যানেলের পরে কি হয় এটা দেখো। ডিপ ডিপ ইনগুইনাল রিং থেকে বের হয়ে
স্যার শুনতে পাচ্ছি না স্যার।
আচ্ছা আমি বলছি,
স্যার আজকে নেটওয়ার্ক খারাপ স্যার, আগামী দিন বললেন।
জি স্যার, আজকে থাক স্যার তাহলে। আচ্ছা স্যার, ডিসকানেক্ট হয়ে গেছে না?
স্যার এখন ডিসকানেক্ট হয়ে গেছে, টিপ নেই।
তাহলে আমরা লিভ নিই। হ্যাঁ
সৈকত এন্ড করে দেয় সবার জন্য, তুই হোস্ট।
তাই নাকি?
করে দে।